Pfizer now says it will ask the FDA to authorize a booster shot of its COVID vaccine for children ages 5 to 11. Here to answer your questions is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Great to have you with us, Dr. Moffatt.
Yeah, good to see you.
Well, Dr. Moffatt, the company, as you know, shared the results of its clinical trial in a press release, and we know that you're still waiting to see the actual data behind that. But what can you tell us so far about dosing and immune response?
Yeah, no, so exactly as you say, we are currently just relying on what they've stated in their press release. But what we know from that is that it was a 10 microgram dose, which was the same as what 5 to 11-year-olds received in the original 2 shots. And this was given on average about 6 months after the second shot. And what they're reporting in terms of immunity when they measure antibody levels about 1 month after the booster is an over 30-fold increase in neutralizing antibody that's specific for the Omicron variant. So that very well may correlate with increased protection against infection with the Omicron variant. We'll just have to wait and see all of the data.
Okay, well, so everyone, of course, every parent specifically wants to know, is it safe? Are there side effects?
Yeah, so what we know again from the press release is that they evaluated the booster in over 400 5 to 11-year-olds that were part of their initial trial, and they described a very favorable side effect profile that was very similar to what was seen with the first 2 doses and a very reassuring safety profile with no safety concerns. So that certainly is reassuring, though it is a relatively small number of people. But I do think there's reason to believe that these boosters should be very safe based on what we've seen in the now millions of 12 to 15-year-olds who've been boosted. And it seems that receiving these boosters that are now separated many months from the second dose of the vaccine has been associated with a very reassuring safety profile. So I would expect that to be the same case for boosters in 5 to 11-year-olds, and especially since they're getting an even lower dose.
So as you know, Dr. Moffatt, that 5 to 11-year-old age group has been slow to get vaccinated. In Massachusetts here, we are doing better than the nation as a whole, but the percentage of kids with at least 1 shot is just 56%. It's the lowest of any eligible age group. Now, they have only been eligible for a couple of months, but parents are obviously making this decision for their kids. Why do you think they might be hesitating on this?
Yeah, I do think that some of that hesitation is based on our finding that young children are less likely to get severely ill from this infection than older individuals are. And while that's true, thousands of children in this age range have required hospitalization, and hundreds of children have died from this infection. And we know that those outcomes are absolutely preventable with vaccination. I also think that there has been a lot of misinformation propagated about the safety of these vaccines. And now that we have millions of children who've been successfully vaccinated with these vaccines, we know that this is exactly that. It's really all been misinformation.
Well, and we don't want to leave the extra little ones out. So, of course, that one age group still can't get their first shot, kids under 5. Any update at all for those parents?
Yeah, I know it's a question that we get a lot. Parents are very eager to hear more about when they might get the littlest ones vaccinated. What we know most recently is that Moderna announced several weeks ago that they have what seems to be reassuring data from completion of their study of a 2-dose series in those under 6 years of age. We are just waiting official word that Moderna has submitted those data for review by the FDA. And we know that Pfizer should be completing evaluation of a 3rd dose of their vaccine in those under 5, and we would expect them to submit those data to the FDA shortly after completing that work. So I think it's most likely either very late spring or early summer that would be the earliest that we might see authorization in this group, but we'll just know more when we hear about FDA submission.